So what I want to do is set out a broader context in which our 2016-17 annual plan is based. I think the NHS is now facing the biggest challenge that it has done in a generation with regards to making that the right balance between the demand and the resources that are available. We have a growing and an increasingly elderly population, and the demands that they make on the health services are ones of growing complexity. Increasingly, the public's expectations of the NHS are also growing. Demands, and part of demands, are about quality of service, location of service, choice. Everybody is aware of the demands being placed on public sector services by the austerity measures. Increasingly, we're seeing pressure that is starting to show in local authority budgets. We're also seeing an increasing tightening of NHS budgets, and therefore the questions of how best to spend money, where to spend money, what gets provided and what doesn't is increasingly becoming part of the NHS agenda. Collectively, this has meant that the additional resources that the government have put into the NHS this last budget have been welcomed, but NHS England have been really clear about where it wants that money focused and targeted, and there is what's called the triple aim for 16-17 for the NHS. So those three areas in the triple aim are that first and foremost that a need to restore and then maintain financial balance across the NHS. Secondly, a requirement to meet quality targets and access standards remains paramount. And then thirdly, delivering transformational change with a real focus on new models of care and new ways of working. Our plan is underpinned by the triple aim, but what I would say is that Bradford District Care Foundation Trust starts from a real point of strength. We have delivered against the targets we set out in our plan last year. We've delivered our financial challenges and come in on budget. And not only that, we've proved throughout the year that we can deliver top quality services, having gained national and local recognition for many of the services that we provide. None of this could be done without great staff, and the whole mantra of being a capable, can-do organisation has been led by the dedication of our staff. Having said that, the 2016-17 plan does come as a really big challenge for the organisation, and the Board of Directors has had to really carefully consider how it prioritises the uses of the resources that we do have available to us. And for those things that we are going to do, we've got to find new ways of delivering service, new models of care. At the end of the day, the focus of the whole of our 16-17 plan has to be on improving experience for service users, focusing on quality of care, quality of outcomes. Working in partnership with service users and carers will be the only way that we'll drive through some of the changes that we need to see in response to the demand and resource challenges that we're facing. So the whole of this plan is focused around service user experience and great quality care.